right, welcome everyone. We'll give it a second before we get started. We do have the Spanish language option available. If you want to switch your language options, go ahead and record that way. You can. All right, I think we have everyone in the room for right now. So thank you, welcome. Thank you for joining us for our COVID-19 media update. Today with us, we have Dr. Eric France, Chief Medical Officer for CDPHE, Scott Sherman, Brigadier General, Colorado National Guard, Director, UCC Vaccine Joint Task Force, and Dr. Rachel Herlihy, State Epidemiologist for CDPHE. And we're going to go ahead and start with Dr. France.
Thanks, Heidi, and good afternoon, everybody. Happy to be here on a nice sunny day for a change. So I have just a few points today for our updates. Let's start by looking at what's been going on with the pandemic. As you know, we're in a fourth wave. It's an interesting fourth wave, though, certainly different in a time of vaccination. Cases seem to be plateauing at the moment. Hospitalizations today were down, yesterday were up, so we're in an interesting spot with hospitalizations. Of course, it's the unvaccinated middle-aged persons in Colorado who are filling the hospital beds. It's not the older Coloradans that are now thankfully vaccinated. Death rates don't seem to be rising significantly, so it's a transition wave as a fourth wave in that regard. Our positivity rate today is between 5 and 6%. And so we'll see what the next week brings us when it comes to case numbers and hospitalizations. Secondly, I'll just say that we're probably in a new spot for our vaccination work. The first few months, of course, we were doing our best to get as many doses out as quickly as possible. And of course, there was high demand for vaccine. Everybody was looking for how they could be vaccinated. And now we're in a phase where we actually have more vaccine than demand. We're moving into a new part of our population work. It's those who would be vaccinated if it were more convenient and was more available. They're looking for more information as well. And so this requires some different strategic approaches to vaccination. I like to talk about the 3 C's. The first is convenience. What can we do to bring the vaccines to persons' workplace, where they shop, their neighborhoods? Make it very simple for those who put it off, but seeing it just out there in front of them would be happy to walk over and get vaccinated. We'll be working at the state with local community organizations, local public health agencies, and of course, primary care doctors to get vaccination in a more convenient location for people. The second C is to connect. And connecting in this context means being able to talk with somebody who can provide you good information about the vaccine. We've done a lot of work to engage with doctors because we know they're trusted partners for individuals who have questions about vaccination. We know people will talk to their friends, they'll talk to family members and others who've had COVID in their decisions. So we'll do work to make those kinds of stories and connections more likely to occur. The third C is communication, and we have our Power the Comeback effort underway. We're going to be thinking about how we make sure we're telling the right stories to everyone across the state, make it easily known to them where to go to get vaccinated and how walking into vaccines will be most simple to do. So the 3 C's is the characteristics, I think, of this next phase of our vaccination work. Then finally, I'd like to just say, as a vaccine update, a personal note, I'm very pleased that my children ages 26 and 23 have gotten their second doses this week. My son and I will be on a hunting trip visiting my father, 84 years of age, in the Midwest next week. And knowing that we can return to a more normal life and do our spring turkey hunt trip because we can travel, we will be safe when we're in small cities and communities at restaurants. We can spend time with my dad. It's going to be great. And so I strongly encourage, of course, everybody to be vaccinated so we can get to a normal way of life. So with that, I'll turn it over to General Sherman.
All right. Hey, thanks, Dr. France. Good afternoon, everyone. Just want to give you an update. So we're approaching 2.6 million doses of Pfizer, almost 2.3 doses of Moderna. This we received in the state, and then 286,000 Johnson & Johnson. So cumulative doses distributed, 5.138 million doses distributed, and we've administered almost 4.4 million doses. So as Dr. France mentioned, there is plenty of vaccine out there for anybody that either needs an appointment or a walk-on at one of our community vaccination sites. Next slide, please. I just want to show, there was some reporting out there like demand has just dropped off dramatically, and that's not the case. Demand has decreased a little bit, but you'll see there with the trend line, and you see the daily numbers as of last week. We continue to see somewhere between 40 and 50,000 a day administered. So still getting doses administered. There are plenty of vaccine appointments available, and certainly welcome walk-ins at our community vaccination sites or at any of the providers, so that anybody that wants a vaccine, it's certainly available to get that. So with that, I'll turn it over to Heidi for questions.
Yeah, so brief presentation today. We want to give you guys a little bit of time to ask some questions. And so for the media Q&A, we'll use the raise hand function. If you're having any trouble with that, go ahead and chat and Ben, and we can go ahead and help you find it. And we will have you say your name and which outlet you're with. And I would love to go ahead and get through everyone's first questions first. So if you have a number of questions or follow-up questions, let's maybe hold those for the second round, just so I can get as many of you through as possible. And so Seth, we'll go ahead and start with you.
Thanks. Seth Klayman at the Gazette. This is probably for maybe a little bit for everybody. So the herd immunity target is at least 70%. How confident are you guys that we're going to hit that, and under what timeline do you think that we'll reach that target? Thanks.
This is Rachel. I'm happy to take that question. So right now we are estimating, and this is through our modeling work with the Colorado School of Public Health, that approximately 40% of Coloradans are immune to COVID-19. And that is either through vaccination or through infection. And we know that the goal that we're trying to get to is probably close to around 70% or 80%. There's some variability in there really with trying to understand what the herd immunity threshold is. It's a little bit of a moving target based on the duration of immunity, things we don't yet know about the virus and immunity to the virus and vaccine. But we do think that, we're probably going to get to that place in weeks to months. It's probably going to be a little while still, which is why we continue to need all of the strategies that we have been using. So wearing masks, social distancing, hand washing, limiting gatherings, all of those things continue to be really important for us to continue to suppress transmission until we can get to that place of herd immunity.
I'll just add some figures to it. So as of 5 p.m. last night, we're 52.4% of the eligible population that have received first dose, and then 38.8% of the eligible population are totally vaccinated. So we're on our way. Still got a long ways to go, but as Dr. Hurley said, we're determined to make those goals to reach herd immunity.
Great, thank you. And Nusha, we'll go to you.
Hey, this is Anusha with 9 News. Apologies, I was a few minutes late today, but I wanted to get some clarity on the variants. I know earlier this week, the state was talking about how the variants are a factor in the hospitalization numbers going up. What percentage of positive cases in the state right now go through that genome sequencing for variants? And based off of that percentage, how are you able to draw that conclusion that the variants are one of the driving forces behind our hospitalizations?
Sure, this is Rachel. I can take that question. So we know at this point that about 7% of the positive specimens in the state of Colorado are being sequenced at our state lab. We think that commercial labs are also sequencing about that same number. So we think we get to probably around 14 or 15% of positives in the state are being sequenced at this point. We're continuing to try and increase that number. We are working on expanding our sequencing capacity at the state lab. We're also working on partnerships with commercial labs to do more of that sequencing at those laboratories as well. As far as how we know that variants are contributing to increased transmission or in turn increased hospitalizations in the state, the way that we are tracking the proportion of variants that are occurring in Colorado right now is through a Sentinel network. So this is a random sample of specimens from across the state that are sent to our state laboratory for sequencing. And based on that random sample, we are able to estimate what proportion of positives in the state are due to one variant versus another. And so that's really where how we're trying to understand what that proportion looks like. And here in Colorado, it looks like the proportion of B117 or UK variant specimens that are coming back is probably around 50%. And we've seen that number continue to go up over time. We know that the B117 or UK variant is more transmissible. There's some data that also suggests that it could be causing more severe illness. So at this point, even if the variant is just more transmissible, that means it's causing more cases, it's infecting more people, that's contributing to more hospitalizations in the state and potentially more deaths in the state as well at this time.
Great, thank you. And I'm not sure who we have from KCNC or News, but
it's me. It's Jacqueline.
Oh, Jacqueline, great.
Hey, yeah, I logged into this account, so it says KCNC. So something that we're trying to follow up here is a group of superintendents had asked that the state do away, at least for schools, to do away with this mandatory quarantine. And they kind of explained one of the reasons was that it's a small ratio of kids. So it could be like a group of 2 kids. And then, hundreds of kids would be affected in their student population as far as the protocols, missing school and whatnot, or remotely at this point. So what do you guys say to that? And is part of the explanation here that you guys don't really have anything to do with this, that it's CDC guidelines? Some of that's confusing.
This is Rachel. I can take that question. So, we are at this point exploring options to try and decrease the burden of quarantine on schools, on families, on students. We do recognize that it is disruptive to education, but there's a balance here, right? And we know that these disease control strategies we're using, isolation and quarantine, are really important and effective at controlling transmission. And unfortunately, we're also at a place right now where we are seeing increased disease transmission occurring among kids. Earlier this week, I presented data that showed that the steepest increases that we're seeing right now are among high school and middle school students. We're also seeing increases in elementary school students and have seen increases in outbreaks in school settings as well. So I think it really ends up needing to be a balance between disease control and education and the risks of those disruptions.
Thank you.
Great, thank you. Any other questions before we go to follow-up questions? All right, Anusha, it's all you.
I have a follow-up question about the variants. So when you look at the conversation and the concern around the variants in Colorado, is the goal, I mean, is 14 to 15% of screening positive cases a high enough number to get an accurate representation of how many variants and how many cases they're connected to in Colorado? And why not screen every positive case for a variant at this point?
Thanks, I can take that question. So CDC's goal that they laid out for us several months ago was around 5%. And so we've certainly, actually, I want to say it was 4%, sorry. We've certainly exceeded that goal in the state. And now that we have commercial laboratories that are doing sequencing as well, we've far surpassed that goal. You know, the intention isn't necessarily to sequence every single specimen. What we're doing this sequencing for is to really have a sense of what's circulating in the state. We don't need the results of a particular variant sequence from an individual patient for clinical decision making. It's really much more about public health surveillance and really understanding what is circulating in our state and using that information to guide our response and understand, you know, what level of these variants might be out there and how they could potentially be contributing to, you know, the rates of infection we're seeing, the rates of hospitalization, or the rates of death that we're seeing. We're also using that data to inform a lot of our modeling work and understand, again, where we might be when it comes to looking at projections around our herd immunity threshold. One of the things we know about the B.1.1.7 or UK variant is that's more transmissible. And so because of that, it could also actually increase the level of vaccination or immunity that we need to reach to reach herd immunity.
Thank you.
Great, thank you. Jacqueline, back over to you. Oh,
sorry,
Jacqueline?
I didn't unmute. I'm sorry, just quick follow-up. Have you guys received this letter from the superintendent so we can just clarify on that?
Yes.
Great. Okay, any other questions? Any other media questions? If you just joined us, we're using the raise hand function. Erin O'Toole, and if you could say what outlet you're with.
Yeah, sure. Hopefully I've unmuted myself successfully. This is Erin O'Toole with KUNC in Northern Colorado. I'm just wondering, you know, with vaccinations going out to, you know, pretty much anyone who wants one, what are the drivers behind the rising numbers of cases in this fourth wave?
This is Rachel. I can take a stab at that. I think, you know, one of the big things that's different with this fourth wave compared to previous waves is the difference that we are seeing that these variants are having. So we know that the UK variant or B.1.1.7 variant is more transmissible. And so it can more easily spread from person to person and can potentially be more difficult to control. Our modeling team has done some work and they'll be releasing an updated modeling report soon that shows that we are seeing an impact on transmission control from these more transmissible variants. And so basically it's saying that we you know, to control spread of these variants, it is more difficult now than it was previously when we didn't have these more transmissible variants circulating.
Great, thank you. Any other questions? All right, Jacqueline, back to you.
Sorry, just clarification here. This is something we've heard a lot. Is it accurate that the transmission rate is low in schools, that many kids who go to school, that's not where they contract the transmission or the virus? Is it from outside of school? Can we get some clarification on that?
Yes, it's a really good question. It's unfortunately a pretty difficult question to answer. And this is really because we know that kids are going to have multiple exposures, just like we've been talking about for months. Adults have multiple exposures. So at this point in time, kids are going to school, they're going to extracurricular activities, they're having play dates, they're out with their potentially vaccinated family members and parents out and about doing things. And all of those are opportunities for transmission to occur. At this point, we have pretty high rates still in the state. And so there's opportunities for kids to be exposed in multiple settings. We do certainly have data that suggests that there is some transmission that does occur in schools. It's really difficult to, though, try and parse out how much of it is within schools associated with extracurricular activities, and then what part of it might be completely outside of our school setting.
Great, thank you. Anusha.
My last question about variants. You had mentioned that you guys are working on increasing capacity for the genome sequencing. What is the goal, and do we currently have the capacity to screen for every positive test that comes through?
That is a question that might be best answered by our laboratory folks, so I might refer you back to our media folks to answer that question a little bit more precisely. We are certainly working not just to increase the capacity at our state laboratory, but also with our commercial partners. So I think we're pursuing multiple options at this point, but I don't have specific numbers to give you.
Okay, thank you.
And Anusha, we can follow up with you for sure.
Ah, perfect, thanks.
All right, Frida, and if you could say which outlet you're with.
Yeah, the Villager newspaper. My question is about vaccinations. Are we, or is the state tracking if there is any geographical aspect to where people are not getting vaccinated? And if so, is anything being done about that?
My hope would be that Dr. Hurley, he would answer all your questions today. However, I will jump in here and take that one. It's a good question. Thank you. It's true, we do track it, and we do see varying vaccination rates by counties. And we think there are a lot of different explanations for that. We know that there's varying levels of vaccine acceptance from the immediate moment when it's offered by a variety of characteristics that might be age, gender, race, ethnicity, rural, urban, political. We've all seen the different things that drive or characterize different rates in vaccinations. And we have, of course, that distribution of people across our state. So certain areas have lower vaccination rates, certain areas have higher vaccination rates. What we have done most recently is we've moved to more of a demand style for where we send vaccinations. And so those places that have high demand get the vaccines. Those places that have vaccines sitting on the shelf don't need more today. We're also trying to understand what is the right communication, what are the right convenience strategies, and how can we better connect with those individuals in those areas with lower vaccination rates. And plans are underway, partnerships are being created so that we can make them convenient and make them more accessible to those folks in areas where the vaccine rates are low.
Thank you.
There's actually just one thing I wanted to add. Sorry, I feel like I'm talking a lot today. But earlier this week, I also shared some data that showed the correlation that we're seeing right now between vaccination rates and transmission rates. And I think that's a really important message. So the counties in Colorado where we see the highest vaccination rates are also the counties where we're seeing the lowest case rates. And then conversely, the counties where we're seeing the lowest vaccination rates are the counties where we're seeing the highest vaccination rates. And so it's, I think, our first indicator that we're really starting to see some population level protection from these vaccines and resulting in decreased transmission in our communities.
Thank you.
And Frida, we can also send you the video from the press conference earlier this week too, so that you have it.
Okay, I appreciate that. I couldn't cover it.
Yeah, no worries. All right. Any other questions? Okay, with that, I want to thank our speakers for joining us today. I also want to thank our interpreters and all of you. And if you have a question that comes up later or a follow-up question, please go ahead and send that to media_info@state.co.us, and we will get back to you. And with that, have a great rest of your day. Thank you.